It has been quite a week of intense and upsetting news, from a gunman opening fire on lawmakers playing baseball in Virginia to the fatal shooting of two Georgia corrections officers when inmates escaped. It is a lot to take in for anyone, especially those directly affected. Joining me now to talk more about this is psychiatrist Dr. David Purselle. Good morning.
Good morning. Thank you for having me.
You're welcome. Thank you for coming in. This is an important topic. It's, as a viewer, let alone as someone directly affected by this, very intense to take in some of this very sad news from the week. And it's actually PTSD Awareness Month.
Correct.
So let's start with exactly what is PTSD.
Well, PTSD, or post-traumatic stress disorder, is a disorder that can occur in somebody after they've had the experience of a very traumatic event, something that puts you at risk for either death or for severe bodily injury.
What are the misconceptions about it? We hear a lot about veterans, of course, experiencing it, but even these big stories we saw this week alone, this could be a concern for folks like that.
Absolutely. I think a lot of people associate PTSD just with veterans and people who have been in combat and war, but actually PTSD can occur in anybody of any age that has experienced a traumatic episode. In fact, women are actually more likely to experience PTSD than men. It can occur after an assault, after a bad car wreck, certainly after a mass shooting, after a rape. There are a number of things that can lead to PTSD symptoms.
And how do you know if you're experiencing those? What are they?
The types of symptoms that someone may experience are some very intrusive thoughts, bad memories that keep coming even when you don't want to have them, nightmares, feeling like you're reliving the situation or flashbacks. There can be problems with severe anxiety, feeling like your heart's being elevated, getting short of breath, especially in situations that may remind you of the traumatic event.
And then how does that affect everyday life?
Well, people with PTSD can have a lot of problems in their day-to-day functioning. Relationship issues can be a major problem. They can be more irritable, get into arguments with their spouse or loved ones. People lose jobs because they have a hard time managing the symptoms and being unable to work in kind of a structured environment and with some authoritarian figures.
What kind of treatment is there for this? I know this is one of your specialties.
Absolutely. There are some very good treatments for PTSD. There's talk therapy, particularly things like prolonged exposure, which is a type of therapy that desensitizes you to the strong response that you can get when thinking about or being presented with events that may remind you of the trauma. And then medications can also be very effective.
And can it have a delayed effect? Is this something that you start to experience these symptoms right after the traumatic experience, or can it be months, years down the road that it starts to happen?
Many people who go on to develop PTSD will have some symptoms immediately after the event. For most people, people aren't going to have these types of symptoms with the nightmares and feeling like you're having the flashbacks. But for those that do, it can be a very traumatic experience and very disruptive to their life. The symptoms can last 3 or 4 weeks, and sometimes they will fade. But if they go beyond that, then that's when the diagnosis of PTSD can be made. The symptoms can actually even come back or start even after 3 months after the event.
And the good news is there is help out there with
Absolutely.
Professionals like yourself. Well, Dr. Purselle, thank you so much for coming in and shedding light on this issue.
All right, thank you.
You're welcome. And for more information anytime, we've got some links for you to check out on CBS46.com. We'll be right back.